Hey everyone, happy, what day is it? Tuesday evening. Coming live here from New Hampshire Dog Walking Club headquarters. Thank you so much for your patience. We had some tech difficulties and we had to work with StreamYard customer service, but they got us through it and we are here now. And I am here with Monica Allaire-McMahon of Barrington Barks Behavior. How are you, Monica?
Doing well after that debacle. We're here.
Technology.
Make it work.
We weren't sure if we were going to make it here live tonight, but we're here now. So thank you again for your patience. I had people texting me and people pinging us in Facebook, wondering what was going on. So let me tell you guys, we always start on time. If we don't start on time, guaranteed it's a tech problem. So we were going to put up a message if we couldn't get to you live. So we are here now. Thank you very much. We've got a great program for you tonight. September is Animal Pain Awareness Month, and I've got Monica with me, who is a certified dog trainer and the owner of Barrington Barks Behavior, as I mentioned, and she recently earned a new certification. And remind me what it's called, Monica.
So I am a dynamic dog practitioner, and
cue the dog.
I'm pretty excited about that too. And what we do as practitioners is assess posture, gait, activities of daily living, conformation, compile information, highlight areas of concern, and write veterinary reports in veterinary language so that we can point the veterinarian in a direction where we feel there's a possible concern for the dog. So that is all done to help get a diagnosis. We cannot diagnose. The only people who can diagnose are veterinarians, and help improve the welfare of that dog, and in turn the human that's caring for them as well.
Well, I think it's important to mention that this isn't just any certification. This is like master thesis of the certification world. There's a lot of things that you had to do and a lot of knowledge you have. And as you're the only one in New Hampshire with this certification?
I am the second person globally to get this certification. The first one of my colleagues is in New York, and there's one in Florida, and 3, I think, now in the UK who all came afterwards. Wow. So it's a pretty unique certification. It was an extremely intensive course, lots of learning about anatomy and physiology, all the body systems, how they interact, learning about therapies, and kind of just how to do appropriate vet reporting. And then that included, this whole process included lots and lots of tech and homework. 2 of my favorites, case studies where we did kind of mock-ups of what we would be doing after graduating. Yeah, very intense, probably the most intense course I've taken.
Well, I really appreciate you taking the time to come live with us this month, because it is a very, very important month, Animal Pain Awareness Month. And I'm excited to learn what you have to share, because I've kind of been following you through this process in regards to all the, the work and the studying you've been done. And I know we're going to talk about a lot of stuff tonight, but a couple things that I want to mention before we get into it. So the first is, we want to see your comments tonight, and we want to see your name. So you need to go to facebook.com/StreamYard and give permission so that we can see that information, because, and I'll give you 2 reasons why. So the first is, if you are a member of the New Hampshire Dog Walking Club community and you ask a question during our live broadcast of our presenter, then you earn an entry into our giveaway for the month. So that's one reason. The second reason is that Monica will be giving away a ticket to one of her Sensory Explorer experiences, either in person or online, depending on where you're located. And I guarantee that's not something you want to miss. miss. That is a great giveaway. My Dakota loves going to her sensory explorers. And I know we have many people in our community who are groupies of Monica now and follow her around everywhere she does her sensory explorers. So again, if we can't see your name, we can't give you credit for that question. So please go to facebook.com/StreamYard and give us permission to do so. So Monica, I think if you're ready, why don't we jump right into it?
Sure.
I know we're going to show a presentation here, and I think the first thing you're going to be talking about is indicators to look for when your dog exhibits pain or discomfort, correct?
I'm actually, it might be a little bit out of order because I think the first thing we're going to talk about is what is pain.
Okay.
We have
So
to have a little bit of an understanding of that first.
All right. So let me toss that up here. Let's see. Okay. Now why? All right. Hold on. And the tech problems continue. No. Okay. Here we go.
All right, so I will just say thank you all for joining tonight. This is a vast area of study, and in the amount of time that we have to cover things, we're just barely going to be skimming the surface. So if something is omitted or not discussed, there's just so much information that we can't fit it all into one little presentation. So Traci, do you want me to have a code word to click to the next?
Nope, just tell me next and I'll get on it.
Traci just gave me a wonderful introduction, but I am Monica Allaire-McMahon. I'm a Karen Pryor certified training partner. I am also very proud to be a dynamic dog practitioner that's accredited through UK Rural Skills. I run Sensory Explorers. My business is Barrington Barks Behavior. And, you know, I have associations with the Pet Professional Guild, friend of the PDTE, etc. Scroll right along.
That's right. I keep forgetting it's on my end here.
I know.
Again, that's one of the tech issues. We've patched together to bring this to you. So
I'm really feeling out of control. And I know you've all heard me talk about agency in other presentations where you like to have control over your outcomes. So Traci, I'm depending on you. So as I mentioned before, the only person who can diagnose any condition is a qualified veterinarian. You cannot go to Facebook. You cannot go to TikTok. You can't go to Instagram. People have opinions, but really for a true diagnosis, you have to go to a qualified veterinarian. So the information that I'm sharing with you today is not to diagnose your dog. So, and I might say this a couple of times throughout the presentation. So what is pain? I have one of the many, many definitions, and I will qualify this by saying human pain and canine pain are not exactly the same thing, but because we share so many body systems and we have done a lot of research, this is what we've come up with. It's an aversive or unpleasant sensory and emotional experience, making an animal aware of danger or threat of damage to tissue. Physiological and behavioral changes occur due to the perception of pain. Pain is a necessary part of life. Pain functions to protect our bodies from further injury or threat of perceived injury. So we can't, I know no one on this planet who can say, I've never felt pain before. And when we can say that ourselves, it doesn't take a big leap to think that our dogs have experienced some type of pain at least several times in their lives. Thank you.
I'm going to wait till I'm going to have you say next because I don't want to change it on you too early.
Thank you. And excuse me if I'm leaning in. My eyesight is terrible. So So we'll just briefly cover a couple of different kinds of pain. We have peripheral pain, which falls into two different categories. That's visceral, and I'm sure some of you have heard the word viscera before, but that's talking about internal organs. So you could have pain in your bladder, in your gut, in your kidneys. Internal organs we're talking about. The only part of the human, the body that does not experience pain is the brain. The brain. The covering of the brain could, but the inner workings of the brain do not experience pain. Then we have somatic, which is skin, muscles, and joints, tendons, and bones. So that's one, peripheral. And then we have neuropathic pain. Neuropathic pain deals with the peripheral nerves of, say, you have your brain, spinal column, nerves coming down. So you could have neuropathic pain in a limb, in your neck, in your skin, or centrally right in your spinal column. There are kind of two ways that we can classify pain, and these two, acute and chronic, have also been discussed as adaptive and maladaptive. So acute pain would be something that is experienced immediately following an injury. And that acute pain will stop as soon as that injury is healed or repaired. And the reason it's been talked about as adaptive is because it serves a function. It serves a function of preventing the dog or human from overusing that limb and interrupting the healing process. So it has a purpose. Chronic pain, on the other side, or maladaptive, occurs when the healing is done. No other changes are going on in the tissues. You could have scar tissue there, but chronic pain, it's not in the healing process. And we have receptors, nociceptors, that will send these signals, spinal column to the brain. I don't know why I added that, but there you go. Like I said, it's a vast amount of knowledge and information. We can't fit it all in.
Right. So this kind of gives us a snapshot of the different types of pain that humans and dogs can experience. A little bit of a better understanding when we're going to the veterinarian, when people like yourself are trying to help better understand what our dogs might be experiencing.
Right. And I'll just point out that the photos that I've included, a gut ache could be a visceral pain, a headache, even though it's not the brain itself experiencing the pain, that could be in your sinuses, neck, and so on. And that would be really, I've lost my train of thought, Tracy. I'm so thrown off because I can't see my screen.
Oh, right, because you're looking at, yeah.
Sorry about that.
Sorry, guys. Yeah, stick with us, guys. With the tech problems we had tonight, it's been a little crazy.
Yeah, that could be neuropathic pain there. And of course, an acute injury would be something like breaking your leg. So next.
All right.
And neuropathic pain can be experienced in a couple different ways. And it's kind of important to note that allodynia is pain from a stimulus that doesn't typically cause pain. So that could be if you're stroking your dog and they're wincing. Typically, you wouldn't assume that a light touch would cause pain. So it is not at all a typical pain sensation. Whereas hyperalgesia is pain from it's increased pain. So if I'm planning on giving you an injection, which I don't because I'm not a doctor, you would expect a certain amount of pain. But with this type, the amount of pain experienced is not in line with actually what is happening. So next. So, and just, a couple of examples, causes of acute pain, and remember that is some kind of trauma, that might be an infection, that might come from some kind of a chemical burn or a toxin. I put quilling up there because I know one of our poor members, her dog just had a quilling incident. Stings, gut issues. Chronic pain could be related to, say, an ongoing dental issue. It's untreated. Osteoarthritis is an excellent example of that because there really isn't any healing going on in the body. And it's just scarring that's scarring and breakdown that's occurring. There's no healing, so it's not acute. Or injury, scarring after an injury to the musculoskeletal system. I will just say that if anyone has a dog that's arthritic, there's an excellent group on Facebook, Canine Arthritis Management, and that's run over in the UK, and they have a wealth of information. I'm currently completing one of their courses right now, but Canine Arthritis Management, good Lord, if you want to learn a little bit more about it.
Okay,
So,
great. Okay, great.
Next. So what does all of this have to do with behavior? So when our body perceives pain through that process of those signals going up through the spinal column and into the brain, those signals are not only being received by the cortex, which is telling us where the pain is located and interpreting what kind of pain it is, but these signals also travel to the limbic system where an emotional response is formed. And this is very simplified. So just so you know, very, very down to its simplest forms. When you have an emotion forming, then from that, you're going to have a behavioral response. Next. And that, that emotional and behavioral output, that could be, I feel angry about the pain, I'm afraid of the pain, I'm irritated, I'm, whatever that might be, however you're experiencing or your dog is experiencing that pain, there's going to be an emotional and behavioral output.
And that could probably be tied into breeds, different types of breeds and age of the dog too, puppies versus a senior dog.
Each individual experiences pain in a unique way. So it's a combination of all kinds of factors. And if, for instance, you have a dog that has had an injury, then their next experience of pain could be more intense. You kind of have this wind-up effect where I've had pain before and now I'm having pain again, and it's worse. But it's a combination of all kinds of factors, how that individual experiences their pain.
Okay.
Next. So there's a very well-known study by Daniel Mills from Lincoln University and others in 2020. He started this in 1990, and it was just recently published. And he runs a behavior clinic, and what he found was that up to 80% of the behavior cases that he saw had a component of pain as a contributing factor. So when you think about that, how many dogs that we consider to have behavior issues could actually be experiencing pain or have pain as a contributing factor to their behavior? And we just, as a dog training community, have not embraced that. We kind of focus on behavior, change the behavior, and we're kind of a little lacking on the pain element of that. In this study, he put contributing factors for pain to behavior in 4 different categories. And he noted that either pain was a direct result of the behavior, or underpinning secondary concerns, pain exacerbated the behavior, or pain accompanied the behavior. So 80% is an awful lot of dogs who their human carers had no idea that they were experiencing pain, and that pain was actually affecting how the dog was behaving.
Wow.
It's really something.
Yeah.
There has been some talk that that number could be even higher. But
Well, and I wonder, Monica, and this might be a heavy topic for another day, but when you think of behavioral euthanasia, you wonder how much of that potentially was due to pain that, didn't get found, and people just assumed that it was ongoing behavior issues that couldn't be solved. But, that begs a different question. I think Dr. Lisa Boyer is watching this as well, because it could be to such the extent that even a veterinarian potentially can't even find the pain. I mean, there's so many layers to this, I think.
I mean, certainly some types of pain are much more difficult to locate, identify, diagnose, and treat, because we're not talking necessarily about my dog broke their leg and you take an x-ray and you see it. Maybe this is internal, maybe it's in the gut, maybe it's in the kidney, maybe it's in the bladder. And those kind of things require a much higher level of diagnostics. You can't just do a physical exam and say, oh, there's the, we'll pinpoint where this is happening. It can be really, really complicated.
Well, it can be really costly too, and I think that's why a lot of people don't necessarily explore that avenue.
Yeah.
Hence the reason why I firmly stand behind having pet insurance, because it will cover many of those issues.
It is always nice to have things covered. I was going to say one more thing about this, and that thought might be gone. Give me just 1 second. Nope, it's gone.
All right, it'll come back to you.
Oh, yes. I was just going to say that, for the last several years, since I've been looking at dogs and the potential that they are experiencing pain, I have had that same thought, Traci. How many dogs go undiagnosed and suffer without anyone ever knowing?
Yep.
It's a pretty heavy thing.
Yeah, I agree.
So we can move on to the next. So some things that we as the human carer might be able to look at to start to think about, might my dog be experiencing any pain? We can look at things like self-protective behaviors. So what I mean by that are things like resource guarding, reactivity, simple things such as your dog is lying on the floor, lying down with a bone, and you approach and they growl at you. Do we really know whether that dog is thinking, hey, this is mine, get away from me? Or could it potentially be that dog feels vulnerable lying down, has an awareness that they can't get away with their resource, so feels the need to say, back off.
Yeah.
Simple as that. What we normally call reactivity, or I call a sensitive dog, barking at another dog in the distance. Is that dog protecting its owner or its human? Is that dog being pushy? Or could that dog possibly be feeling vulnerable because if another dog approaches and there's an interaction, does that dog have an awareness that they could be, if they're in pain, they could be hurt more? So it serves them to keep others away from them.
Yeah, and it's interesting that you mentioned that, because those are things that I wonder about Dakota, because she's always reacting to other dogs. And at first I thought it might be a little bit of an aggressive behavior due to an incident she had in the dog park when she was little. But the more I see her interact with Gilly and be submissive to different types of dogs, I wonder if it is more an unsureness, a lack of confidence. It's funny, unless you really, and correct me if I'm wrong, but unless you really get involved in your dog's everyday behavior and routine, like most people do, you might miss some of these subtleties. And it's just so important, like Dakota is hugely food driven, hugely treat motivated. So I know if she doesn't take a treat or she doesn't eat her breakfast or her dinner, I'm absolutely 100% positive something's wrong with her. But it's not always that easy, unfortunately.
And no, it's not always that apparent. It's some of these things we assign a different meaning to, and it just really will serve us and our dogs if we just kind of open our brains to the possibility that something else could be going on. Even something as simple as your dog is on the couch, having, awake, but having a little rest, and you're like, oh my God, I want to come sit with you. You plunk down on the couch, and that dog growls at you, or that dog moves away, or that dog turns its head and gives you some whale eye. Could what have happened actually be that when you plunk down on that couch, you have jostled the whole dog, and there's some pain in that body, and you've just produced extra pain because you've created all this movement?
Yeah.
You've jostled joints or whatever part of the dog might be in discomfort.
Yep, I agree.
Those are things you really need to think about. And we all know if we have a backache, this is very relatable to me because my back's been off for the last couple days. If someone came up to hug me, boy, stay back. However you need to, just stay back. Just don't touch me. I'm not showing physical signs to other people that my back is bothering me. I'm still walking around. I'm still doing whatever I need to do, but I feel it, and I just don't want anyone too close. So, think about those things that you experience yourself, and then it might give you a little window into what might be happening with your dog.
Exactly.
So maybe your dog is sleeping less and resting more. And typically this is what could happen, is that they can't get comfortable, so they're not getting into that deep sleep cycle, but they seem to be laying around more. And, if you're sore, you might sit down or try to lay down, but you're not really sleeping. And that can affect the perception of pain as well, because then you're starting to get stress built up in your body. So look at your dog's sleeping patterns. It could be a change in play, and it could actually go either way. Perhaps your dog doesn't want to be involved in rough and tumble play or running around. They're guarding their body from being bumped into, or they are seeking out more play because adrenaline plays a role in pain suppression. Change in social interactions, like I said, either with us or with other dogs. The more obvious things, if you know what to look for, which we dynamic dog practitioners now do, postural and gait changes. Maybe the dog is sore or has discomfort in their left hip. So in order to alleviate that, they've weight shifted onto their right hip. And if that goes unnoticed, potentially what could happen with that weight shift is that now your dog is putting too much weight on the right. So that is becoming fatigued and full of discomfort. And that discomfort, it doesn't always just stay in that one spot. Pain can travel up and down into different areas. If you've adjusted your gait because you hurt your knee, the opposite side of you could really suffer some consequences because you're not in balance. Change in eating habits, and whether that could be because there's pain in the mouth, the jaw, or even just bending down to access their food, if they've got neck pain or back pain, that could have an effect on how they're eating. It's not always just my stomach hurts, so I don't want to eat. It could be physical pain in the body. And change in exercise, again, I'm sorry, I've got some dog hair floating around in the air, just as it should be. Change in exercise, are they moving more slowly? Are they potentially not walking? They're trotting instead to try to offload some of the weight from maybe a sore limb, and so they move more quickly to get the weight off that limb.
So you guys, Monica's sharing some great information with us here and some great things to be mindful of. So, I assume if you're watching us, you are worried about your pet either being in pain, had been in pain, or may be in pain someday. I mean, my dog, who's a senior dog, she's 12. She's a medium-sized breed. It has been experiencing some things that I know she's going through something. I can't quite put my hand on it or my finger on it, and neither can the veterinarian. But I want to hear from you guys. What kind of things are you noticing in your dogs that might be concerning to you? Share that in the comment section with us so that we can get a sense of things you might be seeing, things you might be experiencing. One of the things that you said, Monica, that I thought was interesting is the sleep patterns. And that's a huge indicator, in humans and in dogs. And one of the things that we invested in recently is the Phi collar, which is primarily for GPS, but I did not realize that it can also let you know what your dog's sleep patterns are. So we monitored just to get a baseline for Gilly and for Dakota when we first got them. Gilly slept soundly through the entire night. Dakota had 4 instances of sleeplessness. And what we've been finding with her lately is she'll get up in the middle of the night, she'll move to a different part of the bedroom. So from her nice comfy bed to the hard floor, and then she'll get up, she'll go to another part where the hard floor is, but she's switching sides. So, I kind of equate it to being a senior and you're in a position and your hips start to hurt and you need to move around. It might be too soft. It might be too hard. It might be too cold. It might be too hot. So I'm noticing a lot of these things that she's going through that she never did before. And it concerns me. We've been to the vet because of stomach issues and, we're not exactly sure what it is, but it's all those things that worry us as dog owners as our dogs get older.
Right. And I will just add, Traci, with that sleep pattern, it's not uncommon for a dog, because of the way their sleep cycles work, for them to get up and reposition or get a drink. But if that is something that she wasn't doing before,
right,
then that would be of note. So if you're just tracking that now, then I would continue to track it and see if that changes over time.
I would agree.
One of the reasons that I kind of speak about crates, which we'll get to later. But yeah, and I will say, in defense of the veterinarian community, the veterinarian has a limited amount of time to see your dog. It's similar to when you say, my kid's sick, I'm going to bring him to the doctor. They get to the doctor and the kid's like, wow, Artie, I feel great. There's some adrenaline going on there. The doctor doesn't live with your child. They haven't witnessed everything. So they can't always see in that brief consultation the entire picture. So it can be really difficult, which is why it's nice to have a support and some assessments done ahead of time to bring to your veterinarian, where you can highlight, these are the areas of concern. So.
Absolutely. Do you want to go through a few comments and questions we're getting in? All right, let's just take a look here. So I did just put this caller name up on the screen. Nancy had asked what the name of it was. So it is the Phi collar, F-I collar. Let's see. Lisa is saying, I definitely changed my perception when my best friend's dog, Bear, who's 13, she was resting on the futon, and when my mom went to get her moving to go inside, he growled and tried to lash out. Definitely makes me think she was in pain and not just CCD.
And that certainly it's always something to kind of have in the back or the front of your mind before you put a label on your dog or you make a judgment. It really serves both of you to think, why did my dog do that? Could there be something underlying going on that would cause that? And try to put yourself in that situation. I know I had a severe fracture in my knee a couple years ago, and if anyone came near me, I was like, get the hell away from me. Yeah. I mean, I was so sensitized, and I was so in that self-protective mode, and no one touched me. But I was definitely on alert about it and ready to protect myself from further pain.
Well, and Alina says, the memory of Liam's drastic behavior changes when his gut bacteria was heavily imbalanced just came to me. He was in so much pain. He showed me by licking his shadow dog, also exhibiting clingy behaviors and avoiding reaching up onto the couch and his window viewing bench. He also winced and whimpered once when his lower belly was touched. Yeah, those are some really good, clear indicators.
Yeah, and there's a whole nother field of study in the gut microbiota and what can go on in there, and just even things like ulcers and even gas buildup in the stomach, even if it doesn't lead to bloat, that's pressure, that's pain, potentially leading on to diarrhea or whatever. That's pain and discomfort. Licking, you may see in many different scenarios that accompany pain, whether it's licking a painful joint because there is some kind of an analgesic effect by doing that, or just licking surfaces because your gut is uncomfortable, your dog's.
Yeah. Let's see. Michelle says, I don't want to jump ahead, but have a question about shaking and shivering. My oldest has done this most of his life, but he's never had any illness or issues that we've been made aware of. He shakes when he's cold, when he's anxious, upset that you're leaving, but I just wonder about pain. He's 14 now, so I'd like to be able to identify any variances.
So that, Michelle, if you were to come to me and say, I would like to do a dynamic dog assessment, we would take a really thorough history of his behaviors, his activities of daily living. We would do some gait assessments. We do a functional analysis. So without knowing, just from a couple of sentences, it's hard to give you any kind of input on that. But as Traci and I were talking about before, things can go undiagnosed and unassessed. The other part of this is that just because your dog is displaying all of these behaviors, there is a possibility that these are learned behaviors and not related to pain. But I don't think we can rule out. We have to look at pain as a contributing factor. We can't just dismiss it.
I agree.
Cold. And you know what? I shake when I'm cold. And I also live with a rather anxious dog. There's some link to separation anxiety and pain. So, whether he's learned that there are things in his environment that he needs to be afraid of because of a traumatic experience or because of pain, without delving further, it would be hard to say.
But those are great points, Michelle. I know you're talking about Fenway. Dakota's the same way. She shakes when there's a storm outside, when there's a dog that she's excited about, when she's anxious, when she's scared. So yeah, I'd have to think that happens with some dogs' behavior. But yeah, it begs the question, could it be related to some kind of ongoing pain?
Yeah, and I will add in here that any dog who has any kind of sensitivity to noise, there is a possibility that what can happen when not only are their ears designed totally different, the ear canals are like huge funnels. They can perceive higher frequencies. They have these 18 muscles, so they can turn their ears all over the place. So they're already have more sensitive hearing than we do. But if a loud noise occurs, it's possible that the startle reflex that the dog has, so you hear a loud noise, what do? You jump, you tense. If you have some pain in your body, that action of startling and tensing can exacerbate pain or discomfort. So noise sensitivities and phobias can have a component of pain or discomfort.
Interesting. Oh.
Yeah.
All right, so get back into sharing our presentation here.
Okay, so we can go to the next.
Okay.
So what can we do about this? And as I said before, I've given you just a little snippet. The first thing we can do is just be aware that pain is a possibility when thinking about your dog's behavior. As Traci just said, she's doing some observations with her dog with that fee. You say fee collar?
I don't know if it's fee or fi, actually, F-I.
With that collar. So you can just start observing your dog. What do they typically do? And we'll talk about modifying what they typically do in a minute. We can start modifying the environment that we've provided for them, and we'll also get into more detail. We could modify their diet and or the type of exercise. And when I'm talking about diet and nutrition, for dogs that are overweight, obviously carrying more weight on their frame is going to put more stress on everything, but there's an association between the inflammatory response and adipose tissue. I think it's white adipose tissue. There are all kinds of chemical reactions going on, and if your dog is carrying more weight, that can increase the inflammatory response, which is not a good thing. We don't want that. So we want fit dogs. And you can seek professional help. You know, you can go to your veterinarian. You can have an appointment with a great behaviorist who has an understanding of pain, and you can get your dog assessed. For instance, by one of my group, like the dynamic dog practitioners, so that you can start to have a better understanding of whether pain is affecting your dog's behavior. So I think next we have.
Well, and Courtney's asking a question. She says, "Where do we go?" And I'm actually not sure what it pertains to.
So Courtney,
do you want to add a little bit more context to your question so Monica can help you? But yeah, let's go to the next slide. And when I hear from Courtney, we can flash that up.
Sure. So you know how I love pictures, Traci.
Yes.
So when I'm talking about modifying the environment for your dog, I'm talking about things like making sure the temperature is appropriate for your dog. If your dog is experiencing pain and they're cold, that's going to increase that pain. Or they're too hot, that's not good for them. Plenty of fresh water all the time, but you have to be mindful that if your dog is experiencing pain or discomfort, how you're presenting that water to them could be the difference between whether they're accessing what they need or not. If you have your water dish tucked into a corner and your dog is painful somewhere and they're unwilling to go into a corner because there's stuff going on behind them, they might not be drinking enough. If that water bowl is too low and it's uncomfortable for them to get their head down, that could be an issue. So you really kind of need to look at that. How can you provide that water comfortably and accessibly for the dog. And what is underneath your water bowl? So I think that's the next slide, but it's one of my biggies, so I'm just going to start talking about it. The flooring that we have in our homes, yeah, and then we can always go back. The flooring that we have in our homes is not designed for dogs. It's slick and slippery. If you've ever, you can try this. Put some socks on your hands, on your feet. Stand on your floor in a V shape if you can do it, like a downward dog, and see how hard it is to maintain balance. So if you've got your dog's food and water dish just plunked on this slippery floor and it is uncomfortable for them to maintain balance while dropping their head, while drinking, they're not going to drink enough. They're not going to eat enough, or they're not going to eat comfortably. Maybe they'll rush through their food so they can get away from that area and not have to be on that slippery floor anymore. We've all seen the, really cute pictures of puppies slipping and sliding all over the floors. It really is not okay, because you're setting that puppy up for a future of potential arthritis, or even twisting, torquing, any kind of injuries, or the dog that's chasing that ball down the slippery hall and they skid in. So many bad forces on their body, and that's on your slippery floor. So I would encourage everyone to cover those slippery floors as much as you can. I know it's not as aesthetically pleasing, but we're a group of people who are dedicated to our dogs, and if you do nothing else, you can provide them with the traction that they need.
Especially on stairs.
Right. It's not in their ethogram, their catalog of behaviors, to be constantly on slippery floors. The stairs, another thing. Dogs did not evolve to be walking up and down stairs, and oftentimes you will see that dog at the top just go flying off. Really bad for them. Just put a baby gate at the top and the bottom and maybe walk down with them. If you have staircases in your home, you can do the same thing. You can gate them, and then if your dog does need to go up and down, you can just go with them, just to ensure that they're not flying down, crashing at the bottom. The playing fetch, dogs are mainly scavengers with a little bit of hunting. So they never evolved to chase over and over and over and over again. Their bodies are not designed for that kind of movement, that repetitive movement. And what can happen when your dog is chasing a ball? All kinds of things. They're adrenalized, so they kind of get hooked on it, firstly. But as your dog is coming in to catch that ball, it's like they're skidding in to stop, and they're stopping, and it's like a car hitting a wall. The back end is still moving while the front end has stopped to pick up that ball. The body swings around, torques, twists, sometimes they flip. Just think about the forces on their body. If one of us chased an object and that happened to our body, we would be at the doctor immediately. So there are other things that you can do other than ball throwing that can really protect your dog from serious injury, and if nothing else, from repeated muscle strains and such. Again, with the dog jumping into the air, if we throw things up into the air, the dog's hindquarters, you've got a ball and socket joint. Am I making that correctly? Here's your socket. Here's your ball. When they land on that, get my dog right, boom, that's concussive. There is not a lot of give in that joint. They just come slamming down. A little bit better in the front end, where there's a sling of muscle that attaches Instead of a joint, it's just a sling of muscles that attaches the shoulders. So they have a little more shock absorption in the front. But again, they weren't designed to be having those high impacts. Really need to be watching that. I have that little picture of the dog leaping out of the car.
Oh, no, I see that.
Kind of blew that up and had a person leaping out, scaled it up for a person. There's no way we would be doing that 5 times a day, you know, and that dog is coming down with speed, and typically you're landing on the driveway or hard pavement because that's where we park our cars.
Well, in this case, it's in the winter, so it could be a slippery surface.
Yeah. And that could be potential for injury or just discomfort and pain. And this is cumulative. So you might not see anything happen for 2 years, 3 years.
Yeah.
But it's all building. You're really putting tremendous forces on your dog's body, and arthritis, I think, is the number one complaint as our dogs age. And arthritis can start as early as 9 months and possibly 6. I have to just check that. But arthritis can start really early. Just an interesting paper on breeding puppies and the surfaces that we keep them on. When I was fostering, I had a couple of litters, and even having your puppies on a waterproof surface, like a piece of linoleum, when they're born, that can affect how they develop, and that can be a contributing factor to hip dysplasia. So I'm sorry, and now I'm getting like, ah!
Well, and a comment I wanted to make about the dog jumping out of the back there, this last event that we had at Flag Hill Winery, one of our members had this great setup from the back of her vehicle, which I think was an SUV. So it would have been quite the jump for her dogs, who were senior dogs. It was this ramp that unfolded. Then she covered it with, kind of a scratchy surface blanket, and the dogs were very easily, able to come down that ramp. And I thought that was a great setup. But you're right. I think we take for granted that repetitive motion and distance that the dogs are always getting in and getting out of our vehicles when we take them anywhere.
Yeah, ramps are perfect. If we could have ramps everywhere when needed, I'd be great with that. Yeah, and we do. We just, because our dogs do it, we don't think about it. They're not typically saying, I don't really feel like jumping in, or I don't feel like jumping on the couch, or I don't feel like jumping on or off the bed. They typically do it. It doesn't mean it's good for them or that there can't be potential damage. And of course, just this one last one on this page with the dog on the on the collar, kind of setting yourself up there for potential injury down the line. There are many forces that are going on there, not just with the soft structures inside the neck that's not protected by any kind of a bony protection. They're all exposed. This is why I advocate for harnesses, a properly fitted harness. Excuse me. A properly fitted harness will rest on the point of the sternum of the dog. That's a bony landmark. It will come around the neck without falling into the neck, down the back prior to the space where the vertebrae, the thoracic vertebrae, start to stand up, far enough behind the elbows. So you have as much bony coverage as possible with a properly fitted harness. Did you go back to the the picture before that, Traci?
Yeah, sure.
Sorry, I know we probably have a time limit. Yeah, I just wanted to talk about, I think probably anyone who has watched my business page has probably seen me make a few statements about crates. And I know it's not as popular thought in this country because we're so used to crating dogs. However, when you crate a dog, you're removing the opportunity for that dog to, as you said, Traci, get up in the middle of the night, move around, find a cooler spot, a warmer spot, a softer spot, a more firm spot, get a drink of water. You're taking away the dog's ability to fully stretch out. And if we look, even my little dog who's 25 pounds, she's really long. If I put her in a crate that was designed for her size, she could never do that. So that having to assume a position that you wouldn't necessarily choose can be a contributing factor to pain and discomfort. The Europeans in some countries have banned the use of crates unless I think it's like 5 times the size of the dog. They're humongous. Partly because of the effects on the body, and they are managing to keep their dogs intact and raise them without crates, without any adverse effects. It requires change on our part, because when you think about it, a crate really is for our convenience. It protects our home. It doesn't really protect the dog. So I know a lot of people are like, what? You have to crate train. You can still crate train for travel and just in case your dog has to be crated at the vet. But I will tell you that being crated at the vet is very different than being crate trained at home. The veterinary clinic, that situation is not the same as a house crate. So that's my soapbox. And then you see I have this lovely picture of this little dog spread out. Again,
well, Monica, Nancy's curious. What about a playpen rather than a crate? What do you think of that? You like that? Okay.
I do, as long as it's big enough, because then your dog, if you have a bed in there, you have their water all the time. Crate in the car. Yep, that's good. But those X pens, those big X pens, if you think about it for yourself, would you want to be in a box? Or would you at least want a room so you could move from spot to spot, follow the sun, maybe pick a different surface to lay on, stretch your legs a little bit? Yeah, definitely.
Okay.
And again, the dog eating is just, if your dog lays down to eat, is it because they cannot stand and maintain that position? Or is it that the floor is too slick? So we can go to the next.
Yeah, great point.
And then just, like I said to you before, Tracy, about the use of gaits on stairs, being aware of the potential for noises that startle your dog and how that could contribute to increased pain. I always talk about the tags on the collar. If you can quiet those tags some way, do it. That's right next to their ear. And if that noise is constantly in their ear, that can contribute to discomfort. How high do you have your TV? Do you have the radio playing all the time? Maybe your dog needs a break from all of that. Potentially using a long line on a properly fitted harness so that your dog, when they are moving, they can move more naturally instead of stuck to the side and potentially looking up at you. If you think what that might be doing to your dog, where they're walking beside you, constantly looking up. And if you, even after we get off this, try to do that yourself, walk with your head like that.
Yeah.
The other thing is, if you're constantly you have your dog on one side, that's developing muscles in a way that's not balanced unless you switch over, because they're always going to be tending to curve toward you. So with a long line, they can have freer movement and they can move their body more the way that they want to, and maybe avoid more discomfort for themselves. And then, of course, I have my last little picture there of, I think that's little Brutus there. You don't have to always be doing high intensity activities with your dogs. You can meet their needs in many different ways, and potentially substituting that ball throwing, or some of that tug, or some of that really high energy activities for something more calming that is mentally stimulating. And once you're getting into that parasympathetic nervous system, everything kind of calms down. And when you're doing something like that, that is the perfect opportunity to really observe how your dog is moving. Do they choose to predominantly go in one direction, clockwise or counterclockwise? Are there things that they don't reach for with their neck? Do they hop a little bit on a back leg? You can make some really good observations when your dog is moving slowly.
Great examples.
Oh, there we are. There's my little girl, Penelope, doing a slow activity, which is mooching about in the yard and just gathering sense of things. So I'm kind of passionate about all of this, and I feel like I could talk forever. Like I said, just touch the surface. But if if anyone is interested in discussing it with me more, please, you can always contact me through my business email, Facebook, whatever. But I think it's just an area that more awareness is coming to, but we all need to kind of open our eyes and see what's going on.
Yeah, I agree. This has been really helpful, Monica. I think that the pain conversation can certainly go in a number of different areas. And, you and I could probably explore many different facets of what you've only scratched the surface of today. But, I'm curious, can you just give us a tad bit more information about, a dynamic dog
Sure.
assessment, and, how people would contact you, and a little bit more about what that entails?
So what that would involve is an initial, obviously, email me. We do an initial Zoom meeting that usually lasts about an hour and a half, where we go through a very detailed list of your dog's daily life. And once we start talking, things come up and we kind of go down little rabbit holes, but the information gathered there is the start. Then we would be working on getting photographic and video evidence, basically, of how your dog walks, trots, how they stand, how they sit, how they poop, how they pee, how they climb stairs, how they get onto a piece of furniture or off, where they sleep. I mean, it's every detail. We do a functional assessment. And then what happens is, once all of this information is compiled, and this can all be done online, unless you're local and, we can get together, that's fine, but it can all be done online. Then I will analyze everything that's come in, the photos, the videos, and all of the written information and conversation. I'll compile that. I will highlight any areas of concern for my veterinary report. I will put it all into a report, including video links, photos that are marked up, kind of pointing out areas of concern. Anything that happens, the first thing we always do is refer back to the vet, because all I'm doing is assessing. I'm not diagnosing. Never. That would be unethical and illegal. But I get those reports together and make my notes, send it off, and then we go from there. Depending on what has been highlighted, there could be a pain trial. There could be X-rays suggested, or other diagnostic testing.
So you really make a great partner in a pet's pain management process.
I think it's really important that you have a team. When you have a dog that's struggling with some pretty serious behavioral issues, and pain is a component of that, you have to work as a team between, the client, the veterinarian, myself, and potential other complementary therapies, whether that's physiotherapist or hydrotherapist. You all have to work together.
Yep, I agree. Great points, great presentation. Thank you, everybody, for your questions and your comments. And thank you, Monica, for sharing all this fantastic information. I know we'll be hearing more from you in the group. And guys, if there's any additional topics you'd like to hear in regards to pain management or pain awareness or anything specific as it pertains to your pet, go ahead and post in the New Hampshire Dog Walking Club community. Tag myself, tag Monica, and let's see what other pop-up talks we can bring your way in the future. So thank you. Oh, go ahead.
Before you head off, I'm gonna for any other professionals, I can't say enough about my mentor, Gemma Hodson, with All About the Dog Therapy. She is the founder of this course. And for any other professional who might be interested in pursuing a certification, she's the one to go to. She has an incredible wealth of information, and her courses are just phenomenal. So I can't leave here without mentioning her. She's also my very dear friend. So.
Oh, very nice. Good. Thanks for mentioning. Well, thank you again, Monica, for your time. We really appreciate it. I hope everybody has a great night, and we'll see you in the group. Bye, guys.
Bye.